Hi guys, so I'm about 6 days post-op, and I want to do a little video just to say hi to everyone and give kind of a summary, I guess, and tell everyone kind of what happened, give an update, like usual. I feel like everything's like an update or whatever. I swear, I'm hoping during my recovery time I will give you guys some other things to go that I'll talk about here besides my heart stuff, whatever. I know for a while there I was talking about all sorts of different, like, really cool, interesting stuff, and like, I don't know, uh, talking about mental health, talking about poetry, all that kind of stuff. And I want to get back to that. It's just when things kind of come into your life, that's kind of what is all encompassing, whatever, and that's what ends up you talk about. So that still might be kind of what the topic is for a while now, for a little bit at least. And I'm really, really glad to continue on raising awareness about congenital heart defects, and especially with adults, and how we really still need to be taken care of. And yeah, so anyway, so basically Thursday I went in for basically to take my band off. They went in through the same area that I had other sorry my other surgery from. I've had two other open heart surgeries, so they went in through the same surgical site. And they went in to take my band off because my band again was too tight. For those of you who haven't seen my other videos or haven't read my other posts, and my band was like, I'm terrible at explaining this because I don't know like all of the words for it, whatever, all the medical explanation, but basically it was less than, I think, a millimeter, I don't know, something absolutely ridiculous, where basically my blood flow was shooting out ridiculously through like this little area because of my band that was put on. And like I've said before, my band was put on back in 2003 when I was like 14 years old, due to them possibly doing a switch. And that was just because back then they thought that doing the switch on my ventricles, because again my ventricles are, I have transposition of the great ventricles, great arteries, and they thought that maybe they could switch them back, and putting the band to train, to basically train the that part of my heart to become the main pumping chamber, was the best thing to eventually do the switch. So anyway, that band was left on, and when they realized now down the way, whatever, that switch was not good for me, and also because I've become older, it's not needed, and also it was becoming a problem. So they decided that they needed to take it off. Well, the band had also calcified. It was also very, very small, and because it was calcified, They originally thought maybe they could just take it off and it would be easy, kind of an easy thing. But unfortunately, because it was calcified, they had to replace part of my ventricle with like basically a graft. It's the only way I can think of it. So that's what they did. They once they went in whatever on Thursday, they realized they had to do a little bit more. So I did have to go and bypass. And for any of you who've been on the GoFundMe page for me, you've kind of seen some of the updates, I believe, or if you've seen on Facebook, whatever, if you follow me personally, you've kind of seen some of my husband's updates on that, seeing that they had to do more of a drastic, I guess, procedure or whatever. So, but it all went well. So, yeah. In fact, I was in the hospital for a little bit less time. There's always one of those days when it's a little bit harder. My parents and my mom and I have always realized that it's the third day that seems to be the toughest. So I'm, like I said, I'm kind of jumping ahead and going back and forth. And I guess that kind of, I mean, come on, that kind of happens when you've been in the hospital, because timelines don't seem like they are very coherent. Basically, after surgery or before surgery, I don't know, it's just all crazy. You know, when I came in there on Thursday, everyone was so nice. I had the best team. I have the tiniest veins, just so you know, guys. I literally still have scars. I have little small scars still from IV scars from when I was 15, the last open heart surgery I had. And they were just so very helpful and nice, whatever, about everything. And they listened, let me hold people's hands, because I don't like needles and don't like being poked and prodded, as I say that with the giant scar. But yeah, so I'm trying to think what else on Thursday. Basically, when I woke up, they got the tube out, the breathing tube, which is always not fun. I have a really, really small throat, so I'm still kind of like dealing with, you know, trying to swallow and everything like that. Not as badly. And trying to think of what else. So that was basically Thursday, and they gave me Oxy, because I don't know if I've told you guys this, my last open heart surgery was an absolute wreck. And that was when they put the band on. They found out I was allergic to morphine that time. I had a partial lung collapse. I had all sorts of different things. It was an absolute wreck. So this time was so much different. It was a more positive experience. And in some ways, not saying that it was a learning experience, I guess, last time. Because without that experience, I wouldn't have known this time that maybe morphine wasn't good. But found out this time that also Oxy isn't that great for me for pain meds. I just don't do well with pain meds. But I didn't have as bad a reaction as I did with morphine. So, but yeah, which kind of caused my problem on Wednesday. So, yeah, and or not Wednesday. I'm sorry. See, that's what I mean. Time. Like I'm thinking the third day. I don't. You guys are gonna think I'm crazy after all this. I swear, I'm not crazy. Maybe just a little bit. I'm just losing time. But on the third day or whatever, on Thursday, Friday, Saturday was the worst day. Sunday though, I went home. Yeah, so I was only there for 4 days, guys. I was planning, they were thinking that I was going to go home on Monday, and I actually was only technically an ICU patient for 2 days. And then they kept me in the ICU just because they didn't have enough beds for 3 days. And then they finally moved me up on the 4th day, but I wasn't even in there for like the full day by the time I think I was discharged. Like I got up there on the ward like at 8 and I was discharged at like 5. So yeah, it was funny too because that ward was nicer and I was like, oh, this is a lot nice. This is so nice. I have a nice room now, but now I'm being discharged. So, but hey, I had the choice to stay a little bit longer. But it's, you know, you kind of like just want to be in your own bed and not be stuck anymore. And I had like an IV in my neck and I had an IV and I hate being hooked up to all these things and everything, and it's just terrible. So you just want to be comfortable in your own bed. But yeah, so as of right now, I'm doing okay. I'm walking around and getting out of bed here, trying to do as much exercise as I can. Usually the nights are the hardest for me. I don't know if it's just because I can't get comfortable or what it is. My pain level is okay. I have high pain tolerance as it is. And like I said, I don't really use pain medication unless, except for like Aleve or whatever, just because I don't like the way things make me feel. And plus I have reactions to a lot of them. But yeah, so that's a bit of an update. Trying to think of what else to tell you guys what else is going on. Keep on sharing, keep on sharing the GoFundMe page, guys. I really want to get my story out there. And share the Amelia Blackwater stuff too, because that again kind of shares my story, and because I share a lot of stuff on there. And yeah, I appreciate everyone. You guys are amazing. I can't thank you guys enough for all your support. I don't know how to explain, like, having people tell you, like, even strangers and people and family and like people I haven't heard from in ages, like coming out from everywhere, you know, like messaging me and saying like, hey, you know, we were thinking of you, praying for you, thoughts, and like it's just very, 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 very thoughtful, and I can't express enough how much it means to me. And you guys are amazing. You're welcome to message me. I'm gonna be here at home for months. I'm gonna be continuing to write more, whatever. I'm hoping to finish some stuff and do more of my blogging and creating more things. You know how I love how much my Amelia Blackwater page has grown, from where it started with just poetry. Now it's like talking about chronic illness, talking about mental health and everything. And I want to keep that up. I want to not only use it as an outlet, but also to help other people, and get, you know, get things out there. So you guys are amazing. Thank you so much. Love you guys. More videos to come here soon. It helps me to just kind of talk things through to a random camera, I guess. I don't know. But I'm gonna end this before I start just rambling and everything. So you guys are lovely. Thank you.